We've been giving a lot of coverage locally of the vaccine distribution in more of the larger counties in our viewing area. Tonight, our coverage focuses on Dodge County, where fewer doses of the vaccine have been given within the county. Dodge County Public Health Director Amy Caron joins me now to talk about where the shots are and who's getting them. And I should say Dodge County and Steele County, correct, Amy?
That's right, both counties.
All right. Well, at this point, 4 deaths within that area would be considered low. Any death is, too many. But as far as the vaccine goes, how has the distribution process gone? Because in the larger counties, we've reported on a lot of confusion and some problems.
Right. So we have roughly about 20,000 people here in Dodge County. So there's some pros and cons to being in a smaller county with the vaccine distribution. What's happening is we are able to move through some of our priority populations a little bit quicker. I would say when we first started vaccinating, which would have been the week after Christmas, we had a kind of a lower uptake rate on the vaccine. People are a little unsure, about the vaccine. It's a new vaccine. It's under emergency use authorization. So there was a little hesitancy there. We're starting to see a little bit larger uptake rate now. So what we've been doing in Dodge County is holding weekly drive-through clinics. We're utilizing our fire station right there in Dodge Center. So it's been pretty convenient for people to come through drive-through. Now, with these colder temperatures, yesterday we had to move things indoors, but as soon as the temperatures subside, we'll be doing those drive-through clinics. And we can move about 5 people or 5 cars through every 5 minutes.
Oh, that's good. And for the most part, we've been talking about Phase 1A. For counties throughout our viewing area, that basically means our healthcare workers and our 65 and up population. Where are we at in Dodge County when it comes to making sure that those folks are vaccinated and that everyone who wants one has been able to get one?
Right, so we have been moving through Phase 1A. We have a few what we call stragglers that we'll finish up with. But for the most part, the last 3 weeks or so, we've been offering the vaccine to our school personnel and our child care providers. That is when we get enough vaccine. So the first doses that we get each week, we usually find out on a Friday when how many doses we'll get for the next week. So it can range from anywhere from 0 first doses up to about 200 doses, and so it's trickling in still. That seems to be our biggest barrier right now, is getting our hands on enough vaccine. The schools are reporting, our 3 public schools are reporting that they have an uptake rate of about 80 to 85% with their school staff, and we believe through yesterday's clinic we have most of them finished up. So moving forward, we will start offering some limited spots to those that are 65 and older. And I can tell you, I know that population is very anxious to get their vaccine, and we understand that. That is probably the most calls that we have coming into our offices from that population.
Okay, Amy, I have to take a quick break. If you can hang with me for just a couple of minutes, we'll come back and continue this piece of it, because I know that it becomes kind of a sore spot. If people who are 65 and older haven't been vaccinated, and we're seeing the next phase already start. So give me just 2 minutes and we'll come back and talk about that. Continuing my conversation on vaccine distribution in Dodge County. Amy Caron is the Public Health Director for Dodge and Steele County, but we're really focusing on Dodge right now, Amy. And as we talk about the fact that teachers, child caregivers are being able to get vaccinated, that's fantastic, but they're not the top tier priority with our 65 and older. Therefore, those who are in that age group definitely have the question, why haven't I been given that when we've gotten so few doses, yet teachers have been getting the vaccine?
Yeah, that's a hard question to answer. Of course, we take our direction from the federal level and then from the Minnesota Department of Health. We do have an advisory committee that meets at the state level to decide who is going to get prioritized within those different phases. That's the hard part of this. We have so many calls coming into our office and stories from people that are 65 and older that have some of those underlying health conditions that we're really concerned about. And we know that this is hitting that population the hardest. When you look at our death rates and our hospitalizations and just positive cases. So we are, as a public health worker, really anxious to get to this population also. And so we hear them, we hear their frustration, and we're working as quickly as we can. It's pretty difficult, I guess, when we only get 0 to 200 some doses each week.
How do you appeal then to the state, or to 0 to 200 doses isn't enough for even a small county? So who do you talk to say, we need more? We're vaccinating teachers. We still have 65 and up who need these.
Right. I think the issue lies is that the state only gets allotted a certain amount of vaccine each week from the federal level. And so they have to wrestle around and figure out how they're going to allot that out publicly. So we have the two different vaccines right now, the Moderna and the Pfizer. And for the most part, Pfizer has been distributed to our hospitals and clinics and places like that. So I do know that our clinics are starting to get some vaccine trickling in so that they can start with the 65 and older population of patients that are already established with them. So that's one avenue for people. And of course, we have had the pilot sites out there, one being in Rochester, but that's been very, very limited doses. And I've heard quite a bit of frustration from our 65 and older.
And it's not like, let me ask you this really quick since we're right there. It's not like somebody from Dodge County or another county can come in and get vaccinated. I mean, people have to be contacted, and they're the one of the 3 sites here in Rochester. I don't know, do people have to be from here?
No, they don't. It can be anywhere across the state. Okay. In fact, I have kind of a sad story. We did have a 90-year-old gentleman that relayed to us that he actually was able to find a vaccine available, but had to drive himself all the way up to Bemidji to get that first vaccine. And those kind of stories are heartbreaking for us, because we want to be able to take care of people in our own communities and even our surrounding counties. So we're finding that with our drive-through clinics too, that we are getting some people from surrounding counties. Realizing that Olmsted County is a much bigger county than Dodge County and hasn't been able to quite move through the phases quite as fast. So we're open to helping others surrounding us too.
And I know that you work very closely with the superintendents of the schools, the 3 public schools that you have just in Dodge County, and I know that there is so many people want the schools to be open full-time and kids in school full-time, and then there's the safety aspect of this and the teachers, and it's become such a tug of war that you're kind of in the middle with. But when you're talking to the schools, do you have to say, you know what, I know you want to open, I know you have this date set, but you got to hold off because we just don't have the doses to give to everybody?
Right. Yeah, it worries me a little bit. I know a lot of schools are either thinking about it or already in all in-person K through 12. And we know that even with the vaccine right now, because there's so few of us that are vaccinated, we know we still have to take those precautions of the 6 feet of social distancing and the masking. We've been remaining pretty steady with our new positive cases here in Dodge County. But I do worry about bringing everybody back.
Well, Amy, I don't envy your position at all. There's a lot that you have to do, and things keep changing. So thank you for taking the time just to chat with me about where things are at.
Yes, thank you.